Hello, Pain Free for Life members. This is Dr. Rob Van Bergen. Welcome to another 10-minute microcurrent training. So today I'm going to be talking about essential tremors and how we can help manage or reverse them with microcurrent therapy. Now, let's start off with a simple question. What is an essential tremor? So an essential tremor is a neurological disorder that causes your hands, head, torso, voice, legs, whatever it may be, to rhythmically shake. And this can often be confused with Parkinson's disease, but it's quite different. An essential tremor is the most common trembling disorder. Everyone has at least a small degree of tremor, but the movements usually cannot be seen or felt because the tremor is so small. So all of us do it, but we just don't usually notice it. When tremors are noticeable, the condition is classified as an essential tremor. Now, essential tremors are most common among people older than 65, but it really does affect people at any age. Some people believe, because we talk about what the cause is and everything, some people believe that it starts earlier in life and that you don't really notice it and it just keeps going rather than just occurring at a different age or a later age. There's a difference between essential tremors that begin early and that begin late, though. And this is mostly just in the different manifestations of symptoms that may occur. So when we look at what the cause may be, the cause of an essential tremor is largely unknown, but many theories suggest, and this is where we inform treatment from, that your cerebellum and other parts of your brain are simply not communicating correctly. So the cerebellum, this controls muscle coordination, right? So you're seeing where I'm going with this. And as such, a misfire of this cerebellum can create these tremors because it's not communicating effectively. So there's also, as well, a suspected genetic component to the condition. Okay, so that is getting some of the basics out of the way, but how do we actually treat it? So there are two treatment approaches with microcurrent that I like to take for essential tremors. One involves scalar, and the other is a direct microcurrent approach. Scalar can play a role here because scalar energy has the capability to repair damaged DNA on a cellular level. And in the case of anything genetic, scalar can and should play a role because of this potential to heal. So, to make use of scalar energy, you need the scalar chi. And if you're here and you're listening and you're like, oh, so I need the scalar to make this work, don't think about it that way. You do not need the scalar to make this work. This is just a suggestion as an additional thing. So with the scalar, you want to make sure you connect it properly on the bottom. So it has a kind of unique little plug, but it also has a twist component to it. So this little bit here on this area, it needs to be twisted to lock it into place. Once this is in, you can plug it into your device. I'll just use an Evolution here because it works well with the scalar. And you turn it on to 7 to 12 hertz. So that's FM 712A in the Pro Sport. And you're going to increase the power to a level at which you can feel it, because you can sometimes feel it, or until a level where it is maxed. So you go all the way up to maximum. What you're going to do is you're going to just point this at the third eye, and you're going to do 2 to 3 minutes of scalar treatment directly on the brain. Now, I had to go up to maximum today. And this is essentially going to be working on any potential damage in there and trying to fix it. So this might deal with some of these connective issues. So it's really, really easy. Just 2 to 3 minutes a day directly on the brain. Very short amount of time. You're probably not even going to feel it, but the benefit you can reap from it is well worth it. That takes care of the scalar component. So as with everything scalar, nice and easy, right? The microcurrent aspect involves the use of the tongue stimulator tool. And this is in an effort to try and reprogram the brain. So how does this work? So you're going to need to connect the tongue stimulator to your microcurrent device. I think I have, I was sure I had a tongue stimulator, and I do. So point for the tongue stimulator is that it requires 2 pins on the bottom. You can see there's 2 holes. So you use the same wire you use for conductive pads. Doesn't matter which side either of them goes into. You plug it in and you connect it to your device. Easy. If you're using the Evolution, or the Genesis, you use 121 hertz. So you just press that mode button here until you go down to 121, and then you're in the right place. If you're using the Pinnacle or the Pro Sports still, you need to go into AVA and program 199 hertz modulated 3-to-1. This is better than 121. It's the more specific frequency for brain reprogramming. You're going to take the tongue stimulator and you're going to put it in your mouth. Now, close your mouth. You're probably going to feel it straight away without any need to increase the power. But if you don't feel it, you want to increase the power until you do. It's going to feel a little like just a buzz, right? But I don't recommend, like with most things, that you hold the plus button down. Not at all. I recommend that you press the button one at a time. Usually 1 to 4 notches are going to make you feel the tongue stimulator. Place it on the tongue, close your mouth on it, adjust the power until you can feel a gentle tingle. Sometimes, again, this is right away, and use the stimulator for 10 to 20 minutes. I like to do this daily. If you have the scaler, use it first, like I already instructed you. If not, you can do it as a standalone treatment. In my experience, the tongue stimulation alone can potentially stop the condition temporarily or even indefinitely. It totally depends on the individual person, but it is well worth doing it. The scaler, an excellent asset, but by no means is it required to get success. Okay, everyone, thank you so much for joining me. That is it for today. If you have any questions or comments, please leave them below. I will be sure to answer them. Otherwise, I will see you next week for another Monday 10-minute training.